Welcome to Impact OC, the only program showcasing the people and organizations shaping Orange County. With your host, Don Camber.
Hello, live from the OC Talk Radio studios at UCI's Beal Applied Innovation Center. I'm OC Talk Radio Public Affairs Director Don Camber with another great guest impacting our community in a positive way. Today, I welcome Western Dental and Orthodontics Chief Dental Officer Dr. John Luther. Western Dental is the largest Medi-Cal provider of oral health care in California, caring for more than 1.5 million Californians each year, serving one of the most geographically and culturally diverse regions in the country. Expanding access and equity of oral health care is at the heart of what Western Dental does, and that's vitally important to many of our Orange County communities. Thank you, Dr. Luther, for being on Impact OC.
Don, thank you for the opportunity to join you today to talk about oral health and access to care in Orange County. As you mentioned, Western Dental has some 250 offices in California. 11 of those are in Orange County. And the first thing, in order to have access to care, you have to have a location that accepts Medi-Cal Dental. So certainly all of our offices provide Medicaid to our patients. If you have Medicaid, you have dental insurance in Orange County. Some of the things that we do to improve access to care, first of all, you have to be able to understand the kind of health care you're receiving. You have to be able to understand the pricing for that health care. So one of the things we do in all of our offices is hire a bilingual staff so that all of our patients can fully understand the kind of health care they're receiving. For example, in Costa Mesa, several of our healthcare workers speak Spanish. So another thing that is important to many of our patients is our after-hours services or Saturday hours. And that may not sound too important to you, but to many of our patients that work 1 or 2 jobs after hours, it's really important to have access to care when they need it. So another important thing around access is that they can receive as many services as possible for their family in one location. So the majority of our offices are large format, and we call it a dental home concept. So you can not only access general dentistry, but you can access all services such as pediatric dentistry, oral surgery, and the like in one location. That makes it easier for families to be able to get the care they need.
What is oral health equity?
Oral health equity means you have the same advantage to get health care than all of your neighbors. Some folks that have high-paying jobs have other types of dental insurance, and many of those children are able to get access to dental care every 6 months for their entire life. But some families are not as fortunate, so they may not visit the dentist routinely, so they don't have the care they need every 6 months, and consequently they develop larger dental problems.
Such as?
Such as, instead of coming in for just simple routine cleanings, they may wait until they have pain or discomfort from large cavities that require more extensive treatment.
And how do you reach these people?
First thing that people need to have access to care is they have to have a location. They have to have a location that accepts the insurance that they have. And that's what Western Dental does. All of the offices accept Medicaid dental. Therefore, they have a place to go and they're able to get the treatment they need on a regular basis.
How are you able to reach those that are on Medicaid to know that they can have this dental coverage?
Various information goes out in our communities. We do that through our community partners. Medi-Cal Dental also sends out information. And one of the things I'm here to do is to tell people that if they have Medicaid, they also have dental coverage.
And aren't they supposed to get that with their information when they get information about Medicaid?
They do get some of that information, but yet many people, unfortunately, still do not realize that if they have Medicaid, that they are covered.
And why is it important that they take advantage of this?
It's important because with regular dental visits, you can get very easy, simple preventive care. That type of care is not painful. It is very easy to go to the dentist and get, for example, your teeth cleaned and an exam. But if you wait until you have pain, treatment can be much more extensive. Not only is it costly, but that's when it could be painful, or you may end up in an operatory or an emergency room.
So let's talk to everybody. What kinds of preventative coverage or preventative action people should take when it comes to their oral health?
People should take advantage of every 6 months going to the dentist. And we'll start with children, for example. The misconception is that children, because they have baby teeth, they're not important, and you can wait till the child is, say, 5 years old before taking them to the dentist. That is not the recommendation of the American Dental Association. A child and his or her caregiver should visit the dentist within 6 months after the first tooth comes into the mouth, and within 1 year, 1 year old. So why would you do that? Even if they don't have a lot of teeth, the dentist can spend time with the caregiver explaining, for example, good nutrition. He can explain how the caregiver can look for potential issues in the child's mouth. Another issue is that some parents put their children to bed with sugary drinks, and that even could be milk. So if you put an infant to bed with milk, that those teeth are bathed in sugar for the entire evening while they sleep. That's when cavities result very quickly in the child's mouth, and they could get something called baby bottle caries or baby bottle cavities, in which case the child may have a mouthful of cavities at a very young age. That child would then have to go to an emergency room for care.
Is that common?
It is fairly common, and that is some of the oral health information that we need to get out to parents. If you're putting your child to bed, you should put them to bed with water only.
Should they clean their child's mouth somehow?
Yes. So as soon as the first tooth erupts, the parent should begin cleaning the tooth. You can use a very soft rag, or you could use a finger toothbrush to keep that tooth or teeth clean.
At that stage of the game, can an x-ray determine if the child is going to have straight teeth coming in?
No, an x-ray cannot determine whether straight teeth are coming in at that age. But again, with regular checkups, the dentist can help inform the parent or caregiver when the child should seek an appointment for orthodontic care.
So how often should a child see a dentist?
A child should see a dentist every 6 months, sometimes even more frequently if they are at high risk for tooth decay.
We've heard of fluoridated water.
Yes.
Is it in our regular water system?
Yes, fluoridated water is one of the greatest public health achievements of all time. Why? Because fluoride is everywhere in our water. It is in some of our foods. It's in the bottled water we drink. It's in our toothpaste. And it's really a benefit to our young children. But many of our children still get cavities. Dental cavities are the greatest chronic illness for children and young adolescents.
So cavities are still common.
Cavities are still common in many of our communities.
And how does fluoridated water help?
Fluoridated water strengthens the teeth, it helps prevent cavities, and it develops a matrix in the teeth that really keep them stronger. However, it does not prevent cavities entirely.
How can you prevent cavities?
We can prevent cavities by keeping the teeth clean. At home, we can have excellent nutrition, and we can visit the dentist regularly for things like fluoride treatments in the dental office, and also something that they're called dental sealants, where the grooves in the teeth are painted with a material that keep bacteria out of those grooves, preventing cavities.
So when a person gets a cavity, explain what happens in the tooth.
There is a disease that young children get called caries, and caries is a bacterial infection that causes cavities. So when bacteria come in contact with sugar, they produce acid. That acid then sits on the teeth for a period of time until the saliva washes it away. That acid is what damages the tooth surface, causing cavities.
And a cavity is a hole in the mouth.
A cavity is a hole in the mouth. This disease called caries is entirely preventable with good oral hygiene and proper diet, but left unchecked, this disease causes cavities that are also can also pass from baby teeth to permanent teeth.
Cavities pass from baby teeth to permanent teeth.
Yes. So this misconception that our baby teeth are not important, it's just not true.
So when it passes to the permanent tooth, then the doctor can then put in a filling.
Yes, the doctor can put in a filling and repair the damage that is done, but it does not stop caries from progressing in the child's mouth.
And if you don't stop it, what happens?
If you don't stop it, the child can continue to get cavities and have greater and greater problems.
What problems can arise from unfilled cavities?
So unfilled cavities, first you would have a small, tiny hole in the tooth, which could be sealed with a sealant, which I mentioned before. If it's a little bigger, it could be filled with a white or silver filling. But if it gets too large and goes into the nerve, it causes an infection in the tooth, which causes pain. That can result in what is called a dental abscess, which is an infection below the tooth. That infection can spread to the rest of the body and can cause such things as neck infections or even go to the brain.
So let's get back to equity with oral health. Does that exist in Orange County? And if not, what can we do about it?
No, it's not just in Orange County. It's everywhere. We have some communities with a larger population of children who do not see the dentist, but certainly Orange County has a large population of children that need to go to the dentist early and get preventive care.
What is the demographics of those that are not seeing dentists?
So there are many children, farm workers, there are many Spanish-speaking children that are not able to access the dentist as routinely as they should. So we're here to help them get the coverage they need, get into the dentist so they can start on a path of good oral health. It's very interesting to note in studies that have been done that young children that start on a good path to oral health stay on that path their entire life. Conversely, those children that do not get routine care tend to get cavities all the way through their life, through adolescent years.
So it's imperative that they get checked when they're young, but many times they may not get checked till they're a teenager. Then what happens?
The longer you wait, the more problems you could have. So that's why it's so important to make that easy dental appointment when your child is approximately 1 year old.
So if a family's on Medi-Cal, they qualify to get services.
They absolutely qualify to get services, to go in, get their teeth cleaned, get the information they need on how to maintain the child's oral health at home, and when to bring them back for further treatment if necessary.
Would those in need include homeless families? Would homeless families qualify?
Some homeless families do qualify, yes.
So if they're on Medi-Cal, then they would absolutely
Yes,
qualify.
correct.
But the key thing is to get that help with your mouth.
Mm-hmm. And pregnant women also qualify. So certainly another misconception that if you're pregnant, you shouldn't go in for dental care. That is absolutely not true. In fact, some pregnant women get issues with their gums more because of the hormones during pregnancy. So they especially should see the dentist and get the care they need.
Give us a lesson on how to properly brush our teeth.
It's a little difficult without a toothbrush, but typically when you brush your teeth, you should brush your teeth with as an adult, with a pea-sized amount of toothpaste on the brush. You should only use a soft bristled toothbrush, and you should start on one end of the mouth and make little round circles, brushing both the teeth and the gums at about a 45-degree angle. If you brush your teeth for a minute or more, that usually ensures that you have hit all of the spots front and back on the tops of your teeth. You should also brush your tongue because the tongue harbors bacteria.
What about flossing? And if so, flossing before brushing or after brushing?
I wouldn't care if you brush before or if you floss before or after you brush, as long as you do it. And again, the brush does not reach the spaces between your teeth. So that floss, when you put it between your teeth, cleans out those spaces.
And what about gum care?
Gum care is extremely important. I would estimate that over 50% of our adult population has some form of gum disease. Keep in mind that there are two main diseases in dentistry. The first is caries, which affects mostly children.
And that's cavities, right?
That's cavities. The second is periodontal or gum disease that affects mainly adults. And that disease, both of those diseases, are preventable.
And can you see periodontal disease?
You can see the symptoms of periodontal disease. So I'll tell you a couple of them. Bad breath, which is a bacterial odor. Looseness of the teeth, which means that there has been some bone loss as a result of gum disease. And also bleeding and puffiness in the gums. It's a sign of gum disease. If you see any of those signs, you should immediately seek dental care.
Could it be that a person brushes their teeth wrong and that could cause gum problems?
Brushing your teeth wrong can allow something called plaque, which is food debris and bacteria, to harbor on the teeth. When that bacteria goes below the gum line, it starts to damage not only the gums, but starts to erode the bone. So when you start to lose bone from gum disease, that's when the teeth become loose and they can fall out of the mouth.
So if you don't take care of your oral health, what diseases can you get?
Oral health is really linked to overall health in many ways. And we talked initially about cavities. And certainly for children, if they don't take care of their teeth, you can get cavities or abscesses, which then can move to other parts of the body. So that infection below the teeth can move to your throat, for example, closing off your airway. It can also move to the brain, which could ultimately kill you. As far as periodontal or gum disease, that is closely linked to diabetes. So patients that have diabetes tend to have gum disease, and those diabetics with uncontrolled gum disease tend to have a hard time controlling your blood sugar. And if you're a smoker, you can get an oral cancer. And what is so difficult about oral cancer is that it is generally not painful until it is too late. So the dentist is often the very first person to suspect or see oral cancer. And if you catch it early, it is very treatable.
How is it diagnosed?
It's diagnosed usually with a small sore in the mouth, on the tongue, or the lip. It could also be a bump in your neck, the lymph nodes, where the doctor feels your neck, and if there's a hard spot, he may then send you for a biopsy for further diagnosis and treatment.
So I want to go back to fluoridated water for a moment because you said that's a really great invention and it helps. You're saying all the bottled water that we get from the stores has fluoridated water in it, and the water that we get through the tap also has fluoridated water?
Not all of the bottled water is fluoridated. Some is not, but the majority of tap water is fluoridated. And the beauty of it is that everyone that drinks it gets that advantage to taking that extra step towards preventing tooth decay.
What are some of the misconceptions of taking care of your teeth?
The misconceptions of taking care of your teeth. One is start early. Don't wait for your children to get older thinking that baby teeth are something that you can just discard. Don't be afraid of going to the dentist, because a good dentist will talk to you about your needs in a way that you not only understand, but that you feel comfortable seeing that dentist for further treatment.
How can people get in touch with Western Dental?
Western Dental has a line. You can simply call Western Dental's number, and they will tell you the nearest location of an office close to you.
Thank you, Western Dental and Orthodontics Chief Dental Officer Dr. John Luther, for being on Impact OC. And I thank everyone for tuning in. I'm OC Talk Radio Public Affairs Director Dawn Camber. Have an impactful day.
You've been listening to Impact OC, the only program showcasing the people and organizations shaping our community. Right here on Orange County's only community radio station, OC Talk Radio.